Hi, good morning. Hi, good morning. This is Kavita Kundra, and we are on the last part of Ignou Mscdfsm Physiology, Cardiovascular. Factors affecting the peripheral resistance. The resistance offered by the arterioles or resistant vessel is termed as peripheral resistance. Any changes in the peripheral resistance changes diastolic pressure, and the responsible factors are: if more than 30% of the blood volume of a person is lost through the bleeding, then compensatory mechanism may fail. There may be reduction in vasomotor center activity and fall in peripheral resistance. The perfusion in the tissues decrease and cause shock. Emotional disturbing events lead to the fighting object lead to fainting due to vasodilation, and it is called vasovagal attack. It seems to be mediated by sympathetic cholinergic vasodilation fibers that supply skeletal muscles. The treatment is to lie down that the blood flow, especially to brain, is maintained. If the treatment is not immediately done, then the person gets faint and the condition is known as syncope. It is spontaneous loss of consciousness caused by insufficient blood to brain. Anaphylactic shock, trauma, peritonitis, and in this condition there is a production of toxic substances that lead to systematic vasodilation and increased permeability. Stimulation of myelinated pain fibers reduces generalized vasodilation. And factors affecting viscosity of blood. The short-term regulating mechanism. It regulate, maintain the normal blood pressure in spite of factors that tend to disturb it every minute. These are baroreceptors and long-term regulating mechanism. These regulations are mainly through the mechanism, and the harmful mechanism include the catecholamine release from adrenal medulla, renin, angiotensin mechanism of the kidney. Pathophysiology of hypertension. The arbitrary limit is 140 and 90 mmHg for systolic and diastolic blood pressure. The diastolic blood pressure is more reliable for determining whether a person is hypertensive or not, as systolic pressure fluctuates. So, whenever you want to determine whether the person is hypertensive or having a high BP regularly, so you need to check on diastolic blood pressure. Why? Because the systolic blood pressure always fluctuates. If the diastolic blood pressure is found to be 90 mmHg or above for at least 3 occasions, the individual is considered as hypertensive. Classification of hypertension. The causes of hypertension is emotional stress, sedentary life, overeating. Hypertension is primary and secondary. Hypertension is called benign. Malignant hypertension is severe and lead to death if not treated. Renal disease, corn disease, Cushing syndrome is the cause of secondary hypertension. In case of treatment of primary hypertension, vasodilators, tranquilizers are useful, but in case of hypertension, we need to work on the root cause. If you are having stress, so you need to work on your stress. If you are having lots of salt, you need to cut down your salt. If you're not exercising, then you need to go for the exercise. Then the hypertension is itself will get cured. Myocardial ischemia. When a person eat fatty diets like butter, meat, egg rich in cholesterol, they accumulate all coronary vessels and obliterate it, and when the blood flow decreases due to atherosclerosis, it tends to myocardial ischemia. And if the myocardial ischemia is very severe or coronary artery is blocked due to thrombosis, it causes death of myocardium and called myocardial infarction. Doctors remove the clot to restore blood supply. Atherosclerosis, hardening of wall of arteries caused by fatty deposit that build on the inner wall of our arteries that interfere with blood flow. Insufficient blood flow to heart muscle causes chest pain. The condition is called angina pectoris. We already learn about that. We already know that angina pectoris. You might be heard about this term a lot. Aerobics and diet, how to keep your heart healthy. Aerobics and exercises keep the muscle toned. The heart receives the blood supply rich in oxygen and nutrients. The heart is larger in athletes, and the person keeps happy as happy polypeptides get released, endorphins. The morning time is the best time to exercise when the sun rises, and chirping of the bird had positive effect on the health. Eating lots of fruits, vegetables, milk, cereals constitute nutrition and diet. What is ECG and why we need it? ECG is an electronic recording of the heart made by electrodes picking up the cardiac activity from the human body surface. The heart is like generator and it is having good volume conductor. ECG tells us about the rate, rhythm, regularity and state of every heart chamber. Changes in hemodynamic, damage to muscle fiber and change in ionic environment affect the ECG. It is an important diagnostic tool for assessment of cardiovascular function. Few important disease states diagnosed by ECG. Sinus bradycardia, if SA discharge rate is slow, the heart rate is slow, ECG comes to be normal, but the heart rate at the rest comes to be below 60 per minute. It is seen in athletes or hypothyroid patients. Sinus tachycardia, in this heart rate at rest is more than 100 per minute. It is seen in emotional stress or exercise or abnormality in fever. Hypothyroidism and anemia. Sinus erythema, this is increase in heart rate during inspiration and during expiration. The rhythm is seen with breathing during fluctuation in parasympathetic vagal tone. During inspiration, the chest expands and creates suction force that result in backflow of the blood from into the arteria from the. So here you can see that this is the video. We can check when the heart is in the normal condition, then it is, you can check how it is beating, what is the rate. Bradycardia, it's very slow, and tachycardia is very fast. Ventricular fibrillations, this is a fatal condition in which the heart beats like a bag of worms and patient may die in couple of hours. The heart beats when electrical signal pass through this condition and the heart electrical activity become disordered. During this condition, heart lower chamber contact and rapid unsynchronized way. The ventricle flutter rather than beat. The heart is quivering and need to give a DC shock to patient, and it used to jump start the heart. Ventricular fibrillation is seen in two conditions: when a person is electrocuted, and second is as a consequences of heart attack or myocardial infarction. Abnormalities due to changes in serum electrolytes, the intracellular ABD, intracellular and extracellular electrolyte concentration difference is responsible for resting membrane potentials and electrical activity of all excitable tissues of the body. Sodium, the increase in sodium ion concentration decreases the voltage of ECG, and potassium, increase or decrease in the concentration changes the ECG. In case of sodium, only increase is decreasing ECG. That is why we cut off salt. Calcium hypercalcemia may lead to increased force of contraction of heart. So thank you so much. We have done it. We have completed that chapter today, and we will be soon starting with another chapter, that is respiration. I hope you have learned respiration before in your 12th standard. Medical students, everybody learned many times the respirations, what are the organs and all. So please go through the question answers. If anything, any doubts, you can contact me on comment section. Thank you so much. Bye bye. Take care. Stay safe. Stay protected.